Friend, oh my God, we haven't been with each other on this podcast for a
I,
month.
I
You look
know.
so good. How are you doing? Talk to
Yeah,
me.
I'm doing good. I'm doing good. I've missed us getting together and doing our
Right.
on the podcast, but here we are. We're
Right.
back. So yeah, so everything's really good. I mean, I went to a paparazzi convention in Vegas
Right.
not that long ago. Then I had my second and final surgery for my arm. I'm recuperating, and that's gone very well.
Right.
And friend, life is good. So, and I'm just happy to be here with you. So now, how are you doing, my friend?
Well, I'm posting a lot on social media, trying to do lots of motivational and uplifting posts, making sure to be positive all the time. I'm still exercising, so I'm doing that every
Yeah,
other day. I'm hoping to have something coming up really soon, good to share. So we'll wait on that. I'm loving it that we have come back
yeah,
new and improved. And listen,
yeah.
you with this new look, I don't know if I should rub your head or roll you a doobie.
Well, why not both?
All right, so look it. Let's
Oh
let's
my
let's
God.
stop it.
But you know,
All right, so folks,
yes,
go
yes.
ahead, really quick. Go ahead. No, go
No, I
ahead.
just, when you were saying about your post, because you have been on a roll, girl,
Yeah,
all day, all night, I look at my phone and there you are posting all these inspirational, really nice,
yeah,
warm and fuzzy stuff. And I
right.
just want to tell you that you're doing a great job. I love it.
Well, thank you. I
Every time one
appreciate it.
person,
Appreciate it.
you know what? It's very inspiring. It
Yeah,
also is very thought provoking. And
that's what I want.
I mean, love it. I mean, you're just so creative. You got those creative juices flowing, girl, and keep it up. I love it.
Thank you. Thank you. I'm listen. I'm just trying to be positive. I'm in positive space. I'm going to continue to do so, and that's what we want to radiate. So, folks, listen. Thank you for joining us. This is the Women of a Particular Age podcast, where we discuss women's views, life lessons, and a little bit of sugar honey iced tea. So, listen. We've talked enough. Let's get going. We're going to get going on what we want to talk about.
Yeah,
Let's get
let's
in here
get
and get
into
to
it.
talking about. Yeah, let's
Hmm.
get into it. So, folks,
Yeah.
today's topic is going to be the shocking link between oral health and disease. Bum, bum, bum. All right, so now
Hmm.
listen, folks, our subtitle is How Inflammation in Your Gums May Be Fueling Illnesses Everywhere. Now, let's explore oral hygiene is directly connected to the broader health concerns, especially age. This episode could unpack how neglecting oral care contributed to chronic
Hmm.
conditions like heart disease, diabetes, respiratory infections, and even dementia. That's one thing I did not know. I did not know that dealing with oral care could affect dementia. Did you know that, Heather?
No, no, I did not know that.
Right,
But that really perked up my ears. Like, yeah, you really
right,
need to pay attention to your teeth and your gums and your whole
right,
mouth because
right,
it affects so many areas of your entire
right,
body and can create these
right,
illnesses. So
right,
we want to prevent that at all costs.
right, right.
There's a
So
lot
let's
of
get
things.
into it.
Hmm.
Yes, so let's get into it. Okay, so now our first topic is the mouth and body connections. All right, now, when we talk about the mouth and body connections, it's how bacteria from gum disease can travel through the bloodstream. Now, I'm just going to spit some stuff out here, and me and Heather are going to talk about it.
Yeah.
Periodontal disease, also known as gum disease, is serious infection and inflammation of the gums and the structures that support the teeth, meaning the bone. Gingivitis, the mild form that causes redness, swollen gums that may lead to bleeding. If untreated, it can progress to periodontal disease, which it starts to affect. It's the disease that gets so bad it affects the bone.
Yeah.
Perioditis. It can damage the bone and connective tissues that hold teeth in place and potentially leading to tooth loss. Heather, real quick story, and maybe you've seen this before. I used
Yeah.
to work with a lady who I thought was really, really nice, very, very sweet. I remember one time, never seen anything this before, never seen this before, where we were
Yeah.
sitting in the office and she bit into an apple and her tooth came out in the apple. And she just
Oh,
laughed
wow.
nonchalant. But then I had really paid attention, like, okay, you don't have other teeth. Now, folks, keep in mind, we're not making jokes of this. I'm just telling you of things
Mm,
that
yeah.
we've seen. Have you ever
Yeah.
seen something like that? You've ever known anybody, Heather, who's had oral issues with their teeth?
Yes. 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 Family members, primarily on my husband's side.
Hmm.
One relative, she's down to like, 4 teeth at the bottom and 4 teeth on the top because she's had a lot of.
Wow.
Yes. And I had another relative that ended
Mhm.
up having receding gums and had to have oral surgery where they took the skin off the roof of the mouth to repair the receding gum line. And this relative
Wow.
told me after, because they didn't realize how extensive and how painful the surgery was because the recovery was
Hmm.
harsh, said,
Right.
I ever have to do this again, I'm not doing it. That's how bad it was. And I'm like, well,
Right.
and it's hereditary, and this is on my
Right.
husband's side of the family. So, you know what? We do have genetic predispositions, whether it's dental or
Right.
medical, but at the same
Right.
time, we do have to strive for preventative care, of
Yeah.
course,
Right.
always. So,
Right.
yeah.
Right. Okay. Well, listen, let's get to the next. Our next topic is oral health in women over 50. Now listen, with our oral health, it affects with certain hormones with our menopause. We can get dry
Mhm.
mouth. What
Yeah.
Heather said, gum recession, bone loss. Hormonal changes can also affect the gums. A lot of things that happen with women when our hormones change, whether things
Mhm.
are going up or going down, it really can affect us. Sometimes you see
Yeah.
us women with a mustache, a little bit of a beard. There's a lot of things lots of things that happen. Okay, they even talk about
Right.
that women have specific oral care issues through puberty. The gums can be red, tender, swollen, and bleeding more easily. And they do
Yeah.
recommend that you have good oral hygiene and regular dentist cleaning essential during this stage. Okay. So they do
Yes.
recommend that. They do recommend that. Now,
Right.
let's get into the silent threats. All right. Now,
Yes.
Heather, what do you think some of the silent threats are besides your gums bleeding a little bit? Maybe what are some things that you think are some silent threats when you
Well,
start to see like gingivitis and periodontitis?
yeah, well, okay, couple of things.
Hmm.
You, your teeth becoming loose or looser. You
Yes.
you know, bad breath, right? Could be
Yes.
bad. You could get mouth sores, and I'm talking more like, yeah, sores along your gum line or in your mouth. Something.
Ooh.
These are things, and then some people grind their teeth at night as
Right.
well.
Right.
And
Right.
some
Right. Right.
people
Right.
may not realize it until they go to the dentist, and the dentist will see the damage. And two,
Right.
maybe the person, if they live with somebody, your significant other or whoever you share your
Right.
bed with, they might hear you be grinding. So hopefully they'll say
Right.
something, right? Because those are things that you need to go to the dentist, and they need to examine your mouth and see what's really
Right.
going on. If it's something
Right.
that's benign, something, you know, a one-time thing, but
Right.
sometimes things can be serious, and so some of those things can lead to more serious things. And then your dentist will let you know, right?
Right.
Are you the patient that needs to come twice a year, or are you the patient,
Right.
do you have more issues that you need to come every 3 months or
Right.
3 times a year? So that's
Right.
something that's discussed between you and your dentist, because you want to keep that oral
Right.
hygiene, and you want to get
Right.
checked, regular checkups, according to what your health risks are.
Right. Right.
Mhm.
Okay. So listen, let's, yeah, because I don't want
Yeah.
us to get to because we're about to get to talking about the specials. So we're gonna get there. Okay, so now listen. Chronic illnesses and oral hygiene. Now, there's a lot of oral complications with oral hygiene, meaning that people with diabetes, people with heart disease, autoimmune disease, sometimes could have poor health. It could, when you have blood sugar issues, it can be an increased heart risk. Okay, now a lot of people don't know.
Yeah.
One of the things that me and Heather talked about before, please make sure, folks, that you guys floss because that built up plaque
Mhm.
could move through your bloodstream to your heart.
Yeah.
And that is one of the things that
Yes.
we did discuss on here that we saw. Now,
Yeah.
let's get to when to see a specialist. Heather, go ahead very quickly and let everybody know the difference between your general dentist, and your dentist. I
Yes.
can't even
Yes.
say it. Can you say it for me,
I,
girl? My
yeah,
God.
it's kind of a toughie. It's a toughie. But
Yes,
your general dentist is the one that you go to have your regular checkups, right? To check your
right.
teeth, your gums. A general dentist does takes care of cavities, with fillings,
Mhm.
veneers. Looks at if you're having tooth pain to make a diagnosis. They do
That's right.
straight root
Right.
extraction,
Yeah, yeah, regular
crowns.
extraction. Mhm.
Yeah, and gum disease, low level gum disease, treatment. They treat adults and they
Right,
do treat children and they do
right.
restoration of teeth. Now, the general dentist is kind of what a primary care is in a medical insurance. It's like your
That's right.
primary
Right, like what we
care.
discussed in our last episode before we
Yeah.
left and didn't come back.
So right. So now this general dentist, if it's something outside their scope, then they're going to refer you to a specialist. Which now we're moving on to a periodontist, and the
Periodontics.
periodontist
Yeah.
deals with the gum and periodontal diseases. They also
Right,
deal with dental implant surgeries.
right,
They also do cosmetic gum surgery, right?
right.
And they do handle all the delicate tissues of the mouth, anything relating to that. And really, their job is to try to preserve your gums and be
Mhm.
able to preserve the bone, or if they need to generating healthy bone to
That's
hold
right.
your
Right.
teeth in place.
That's
Right?
right.
Yeah.
That's right.
So that's in a nutshell. What those
Okay.
two dentists do. Yeah.
Yes, and folks,
Mhm.
please understand, by the time you get to periodontist, things are pretty bad. So,
Yes.
please make sure you take care of your teeth. I know that a lot of people have an issue going to a dentist because they're afraid, and I totally get that. But I would rather that you go to the dentist and be afraid than be losing your teeth. Your teeth are very
Yeah.
important. If you don't have teeth, you really can't eat good. It really
Right.
does affect your life a lot, and not just with your inner body,
Right.
but how you take in food. So and just also too, how you address the public. One of the things that people see when they first
Yes.
notice you is your teeth. It's
It's
really, really important. It really is.
because we communicate with one another by speaking. So when your mouth is moving, people are generally
That's right.
looking up here, looking at your mouth when
That's
you're
right.
talking. And what you mentioned about nutrition, by eating, it is really important to be able to chew
Right.
foods, right? I mean, teeth that you're able to have, because
Right.
dental
You have to be able
implants
to
are
eat.
very still expensive. But
Yes. They're very
it is,
expensive.
yeah,
And
yeah.
insurance doesn't
Like
pay
my
for that.
no, and guess what? I had one dentist that once said to me, he said, floss, brush the teeth you want to keep. And I said, okay, that's a good tip. So I guess you're saying we should all be brushing all of our teeth and flossing all of our teeth. And I laughed, right? But that was his
Right.
little thing he would tell the patients. And I'm like, but
Right.
really, it's true. You got
It
to,
is true.
not just
It
the
is
one in
true.
the back where you get stuff stuck. You
Right.
got to do, and you got
That's
to do it
right.
regularly.
That's right. We got
Yeah,
to get all of them.
it
We
takes
got to
an
get all
extra
of them.
couple minutes,
Right.
morning
It
and
does.
night, but it's
It
well
does.
worth it.
It most
It's well
definitely is
worth to
because we
do.
want to keep our teeth.
Yes.
All right, so now listen, let's switch gears because we got two
Yeah.
good movies that we want to talk about. Okay. So,
Oh
folks,
yeah.
our first movie, and now both of these movies, folks, are on Netflix. Both of them are on Netflix. Okay. So now our first movie
Yes.
is The Hunting Wives. And let's go ahead and let's see if we can find a picture of them. Okay, because I know we have it and we're gonna get it going. All right.
Yep.
Awesome. Heather, look at the old lady getting it down, girl.
Yes. There we
Okay.
go.
So now let's get the description of the
Right.
hunting
Woo,
wives.
got those
Okay.
guns up.
All right. So The
Yeah.
Hunting Wives is an American drama television series based on a novel by May Cobb. It stars Man Ackerman, Brittany Snow, Dermot McNaury, Evan, I can't pronounce that last name, Christy Metz, Jamie Ray Nay. Now, folks, let me tell you guys something about this movie. Okay. We're only going to give you our favorite part. Okay. Because we really want you to go see it. Now, my favorite part, and I'm not going to say movie, a series.
Yeah.
My favorite part of the series was the beginning where the young lady, her the husband's the new husband, the husband and her who moved to this town, when she meets the boss's wife in the bathroom, and the boss's wife takes her clothes off. Now I knew right at that scene that she was trying to groom her. That's what was hilarious about it. Now that was my favorite part
Yeah.
because there were so many good
Yes.
ones. Now Heather, tell us your
Yeah.
favorite part of it.
Well, my favorite part is when Sophie and her husband, they moved to the small town in Texas, and the new boss of her husband with his wife Margot, which is the lady you
Yeah,
spoke to about meeting Sophie, Margot and Sophie. And so they got invited over to the boss's and Margot's house for dinner, right? And then there's a
right.
point where the Margot and the husband, Sophie's husband, kind of leave because she's going to give him a tour of the house. So Sophie is there
Mhm.
alone with Margot's
Right,
husband. So he comes out with this, I don't know, 1800 scotch or something. He does offer
right,
Sophie
right,
with, but Sophie's not drinking at this point. She used to drink, but she's not. But
right,
he
right, right,
makes it sound like
right.
it's okay. It's between you and me. Okay. So, anyways, so he gives her the drink and da da da, and he puts his hand right on her thigh, and that's like,
Mhm.
that's already saying, like, kind of like, he's trying to open that door, right? Like,
Well, because
I
that's what
like
they both were
you.
doing. They both were actually grooming. That's really what they were doing. They were
Yes,
grooming the
both of
situation to get it
them.
going.
It's
And I'm telling you, folks, if you
yes,
guys want to see something that's
yes,
very racy, exciting, eye-catching, lot of
yes,
twists and turns in this,
yes,
but a lot of nastiness. If you are looking for
yes,
something like that, I'm telling you,
yes.
The Hunter Wives is the movie for you. Please, it's on Netflix. I'm telling you, it's probably about 8
It has
episodes.
everything.
Yes,
Yes,
it does. It has everything, and
yes.
it will keep you focused on
It
it.
has everything you want to
Okay.
see.
So, yes,
Everything.
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 All right. So now
Sexy,
let's
salacious,
switch gears.
politics. Mm-hmm.
Everything. So let's switch gears.
Yep.
So let's get to our next movie. And
Yes.
our next movie is, let me switch it back. Our next movie is Titans, The Rise of Hollywood. And this one was an awesome movie.
Yeah.
Let's give it a quick description. The Rise of Hollywood offers a compelling historical account of the early Hollywood studios, but is often criticized for flat storytelling and weak acting, making it mixed watch of viewers' interest in. Now, folks, let me tell you something. Me and Heather both saw this. I'm going to tell you something. This was excellent. If you don't know anything
It was
about
great.
Hollywood, when we say
Yes.
Hollywood, I'm talking about what Warner Brothers Studios is. I'm talking about what Paramount Studios is, Universal Studios. All those are in this one area, which I don't really think that we think about. If you see this movie, it will give you
Yeah.
the beginnings and the endings of how this went. Now, I can tell you my favorite part of the movie. My favorite part of the movie is when Mary Pickford, and you'll have to see the movie to know who she is, when she decides that she wants to run up against these titans, these men, and start her own company. Now,
Yeah.
that's all I'm going to give you because it's really something that you really got to dig your teeth into.
Right.
If you really want to see, it's really good. Now, Heather,
Right.
give them your favorite part of the movie.
Favorite part of the movie is the Warner Brothers, the three brothers, as you see on the screen. One of them is thinking very outside the box and innovative. He would like to do a talking movie, but the older brother is not really on board with it, and so Sam, the one brother that wants to do the talking, ends up meeting with another competitor, and it was offered a job so he could do a speaking movie. So he goes back to his older brother, and the brother thinks he's joking, like, oh yeah, I got an offer, I'm going to be leaving because they offered I could do a talking movie. And the older brother did decide, okay, you know what, I don't really want to lose my brother, because they were very tight knit, and thought, okay. And so Sam decides to stay, which was great for the Warner Brothers, because you know what, yeah, you have to see it, but it was a great move for the older brother to say, okay, let's go there and do it, and not be so stubborn and not think only one way, because this really opened the door to this technology and just went boom, so it was good. It was a very good series. I really enjoyed it. I love the history, and I love all the characters and the families and everybody involved. Yeah, it was very good.
And folks, just understand, you're going to be able to see a lot of history. A lot of history, a lot of history. I'm telling you, this was wonderful. Each one of these movies gave you information. It gave you inspiration. I mean, some of it was salacious. I mean, even in the Titans movie, there were a couple of things that were kind of salacious. But I'm gonna tell you, at the end of it, you're gonna love both. I promise you, they're both on Netflix. You'll like them, right? And listen, they're short series, but I promise you, you'll love them. You'll love them. You'll love them. So listen, folks, thank you so much for joining me. We haven't been here in a long time. Heather, I love you. I'm so glad to see you. You look so good. I'm glad that we're back. And folks, listen, before we leave, like, share, and subscribe. Jolly Studios at gmail.com, www.jollystudios.com. We will see you guys next week. Thank you so much, and have a good one.
Yes, thank you. Thanks for stopping by.